Hello friends, welcome to a new topic, histopathology. Histology, the study of normal tissue at microscopic level, is called histology. Histo means tissue and logy means study. Histopathology, the examination of tissue for presence or absence of changes in their structure due to disease process. It based on following process: sample receiving, fixation, grossing, tissue processing, embedding, section cutting, staining, and mounting. Then, some important terms. Biopsy. It is a surgical process in which tissue are removed from a living body to diagnosis for histopathological examination. Autopsy. It is the process in which tissue removed from non-living body to detect the origin of death, either natural or artificial. Then fixation. It is the process in which tissue is preserved, physical, chemical, and architecture is stable in living organism. Fixative. It's a medium, solution, or spray that preserves the tissue or cell or specimen. Another definition: fixative is an agent that preserves the architecture of tissue as well as in original form in human body. Normal rate of fixation time 1 mm per hour. Properties of ideal fixative: penetration the tissue quickly, non-toxic, non-irritant, non-allergic. It must isotonic, means neither hypotonic nor hypotonic. Causes minimum loss to the tissue. It must avoid excess hardness. Classification of fixative: two types, physical and chemical. Under physical fixatives, heat, spray, air dry, microwave, sunlight, freezing, and hot air. Then under chemical fixative, it's two type, simple fixative, then compound fixative. Under simple fixative, ethanol, methanol, formaldehyde, glutaraldehyde, butanol, picric acid, potassium permanganate, acetic acid, oxymum tetroxide. Then under compound fixative, 10% formalin, 10% formal saline, 10% buffered formal, Zinker's fluid, Hallis fluid, and Fleming's fluid. Other types of fixatives are protein denaturing fixative, methanol, ethanol, and isopropanol. Cross-linking fixatives, formaldehyde, glutaraldehyde, metal or oxidizing fixatives, potassium dichromate, and mercuric acid and picric acid. Coagulant fixative, mercuric oxide. Non-coagulant fixative, 10% formalin and 10% formaldehyde. Formaldehyde. Formaldehyde prepared by adding 40% formaldehyde gas to 60% distilled water. That means for 10% formalin, we have to add 10% of 40% formaldehyde and 19% distilled water. So that for 40% formalin, we have to add 40% of 40% formaldehyde and 60% distilled water. So for 100 ml of 10% formalin, we have to add 10 ml of 40% formaldehyde and 90 ml distilled water. At last, we have to add 10 to 20% methanol to prevent polymerization, means reduce the turbidity effect. The advantages are: it's cheap, easily available, not causes excessive hard to tissue penetrate quickly. Disadvantages are skin dermatitis, tissue slightly shrinkage, blood and muscle penetrate slowly. Sometimes formalin pigments that's brownish color are seen. Then glutaraldehyde 2 to 4% called glutaraldehyde are used. It can use in case of electron microscopy. It's very expensive and slow penetration power. It's the disadvantages. It causes minimum shrinkage than that of formaldehyde. It's the advantages. Then 10% formal saline, 10 ml formalin and 90 ml normal saline used for brain fixation. Then 10% neutral vapor used for liver, spleen, lymph node fixation. For making, we have to add 900 ml distilled water and 100 ml formalin, disodium hydrogen phosphate 6.5 gram and dihydrogen sodium phosphate 3.5 gram. Zinker's fluid. For making, we have to add mercury chloride 50 gram, potassium dichromate 25 gram, sodium acetate 5 gram and distilled water 100 ml. Helix fluid. It's used for connective tissue fixation, prepared by Zinker's fluid and 5 ml formalin. Then factors affecting tissue fixation. If the temperature increases, then the rate of fixation increases. Fixation rate is also depend on the size of the tissue. Means size must be 1 to 2 mm. If the size is greater, then the fixation rate decreases. 5 mm tissue fixation within 12 hours. pH must be 4.9. In the next video, we will discuss about the other sections. Thanks for watching. Like, share and subscribe.